Actually, I would like to give some overview of what I've been presenting at ESMO meeting. I presented at ESMO meeting. As you mentioned already, we're working in cellular therapy, and in particular, we are working on the application of CRISPR technology for cellular therapy. We are mainly working in immunotherapy, so now we can modify cancer patients' T cells to increase the efficacy against the tumor. And to do that, we are employing different nucleases. We started with the zinc finger in the past, because our main approach is the one to destroy the endogenous TCR repertoire by employing nucleases in order to generate an army of T cells that are able then to destroy the tumor. We started with zinc finger, but we soon faced the issue that despite the high efficacy of the procedure, the problem was the long manipulation procedure, because we needed like 4 or 5 weeks to generate manipulated T cells, because we needed to destroy the genes sequentially. While for CRISPR, with the advent of CRISPR, the situation got much better, because the CRISPR have the feature to enable the multiplexing disruption of genes. And with this, we can now generate a cellular product that is specific for the tumor in a couple of weeks. So a time frame that is much more compatible with clinical application. So our experience with CRISPR actually was really, really productive, because we are employing CRISPR not only for destroying the endogenous TCR repertoire, but also for destroying inhibitory receptors that we know they are a hallmark of exhaustion. So we know that in patients' T cells, in cancer situation, the patient's T cells are exhausted, so they are not able to function properly because they express in the surface inhibitory receptors. So thanks to the CRISPR, we can now destroy not only the endogenous TCR repertoire, thus avoiding all the risk relating to the mispairing and generation of unwanted specificity on the surface of the T cells, but we can also overcome the immunosuppression of the tumor microenvironment by destroying, for example, inhibitory receptors. And in particular, one of the thing that we also tested that is something really nice that is coming up in recent years is the comparison of disruption of the endogenous TCR repertoire with CRISPR and then delivery of the transgene by lentiviral vector, or disruption of the endogenous TCR repertoire by CRISPR and then targeted integration of the transgene directly in a specific position of the genome. And actually, we could see that when we introduce the T-cell receptor that is specifically recognize the tumor directly into the T-cell receptor locus, into the alpha chain locus, we could observe a much more efficient of the T-cell product in vitro, but most interesting, most strikingly in vivo. In fact, we could see that there was an enhanced tumor control. So, and an enhanced fitness of the T cells. So actually, I would say that our experience so far with CRISPR is really productive, and we're just working on a side part of all what we can do now with CRISPR technology nowadays.